Prof, we are sorry we didn't start when we scheduled the event. So it is now time for you to come, sir, for the health talk. We need to listen attentively because whatever we hear will be something very crucial, critical to our health. I remember intervening in 2013. It's really good.
Thank you very much, MC and my friend Humphrey. The registrar of our unique university librarian, and all the directors seated here, our friends, members of the press, ladies and gentlemen. I feel very comfortable because I'm in a familiar terrain. I'm seeing so many faces that I've known in my many years of being in the university. So I also feel comfortable because I'm talking to people who are considered the engine room of the university, because I'll be talking about the engine room of the human body. So when engine room meets engine room, it means that things will work very well. I thank the organizing committee, and again, I understand the excitement. You know, when you have to organize a program like this, so many things happen. So I was there a little earlier, and I had to go attend to some things at the teaching hospital, so I'm back now. I told the Director of Academic Plan that I'm happy that the multimedia projector is not working, because some would have glimpsed into my inaugural lecture before the lecture. So the much you can get will just be a bit of what you hear, but you won't see the pictures until that day. So make sure you are there at my inaugural lecture so you see the full load. Causes and prevention of cardiovascular diseases. I will talk about the causes, complications, and how to prevent cardiovascular diseases. My name is Chibuike Eze-Nwafo, Professor of Cardiovascular Medicine, University of Port Harcourt, and the current head of Department of Medicine, both at the University of Port Harcourt and the teaching hospital. I'm also the clinical director of Good Heart Medical Consultants. So you can see everything around me is heart, heart, heart. So my desire is that at the end of this talk, you see the importance of your heart and how you have to endeavor to have a good heart, because if you have a good heart, then you have good health. If you have good health, then you have good life. So you can see good life is centered on having good heart. You agree with me? Yes. Thank you. I'm a staff of the University of Port Harcourt, so I'm a teacher, and that's why I wasn't quite comfortable now having a slide shown on the screen. Teaching methods. I have education amongst them into communicable and non-communicable diseases. Communicable diseases are those that can be passed from one person to the other. If somebody is having catarrh, viruses around you, if you sit near the person, you could pick up the virus, you can pick up the bacteria, you can pick up the infection. So communicable diseases are infections. Non-communicable, these are those that cannot be picked up by sitting near someone or by exchange of material. So those are non-communicable. So the non-communicables are the ones that cannot easily be transferred from one person to the other. even though we know that there are some genetic components to some non-communicable problems. But to a large extent, over 50% of the non-communicable diseases are accounted for by cardiovascular problems. So the heart and heart-related situations account for over 50% of non-communicable diseases. These are direct. Indirect data will suggest that even the other things we think are non-communicable, for instance, cancers, many of those who die of cancer don't die because of the cancer cells. They die because of the cardiovascular complications associated with the cancer or the treatment of the cancer. Diabetes mellitus is an endocrine problem, but we also know that diabetic patients end up with problems related to the heart and the blood vessels. So we consider diabetes now as a cardiovascular problem. Respiratory diseases will affect the right side of the heart, but ultimately the whole heart is affected. So communicable diseases are problems in the environment, but now we are seeing that a large number of people in developing countries are also having problems of non-communicable diseases. So it becomes a double jeopardy. We have not addressed the infections enough in developing countries, but we're having many more people in our countries coming down with non-communicable diseases. So it's something we must take seriously. And of this whole thing, the heart and the heart-related problems are the leading cause of death. Again, like I said, it could be the direct or something that happens subsequently, but ultimately, the heart bears the brunt. And the major cause of heart problems is systemic hypertension, followed by diabetes and abnormal cholesterol. Now, it is very difficult to have somebody with one of these problems in isolation. Many times, diabetic patients also have hypertension. They have issues with their cholesterol. Sometimes they be very obese. And sometimes they're in one place, they don't move around, sedentary lifestyle. So cardiovascular risk factors appear to converge. They coexist. We call them comorbidities. So people that have hypertension could also have diabetes, could have dyslipidemia. Dyslipidemia means that the cholesterol level is not in the right proportion. I hear people say, "Doctor, I have cholesterol." That is a wrong expression. We all have cholesterol in our body. What is wrong is having abnormally high cholesterol. That is the problem. So cholesterol is there in every human being. We need cholesterol to form our hormones and all the activities. But when the levels get very high, it becomes a disorder. Obesity, renal disease, all these are things that could coexist with hypertension. So we know that more than 80% of people who have hypertension also have comorbidities. Comorbidities refer to those other disease conditions that could coexist with hypertension. More than 80% of those who have hypertension have coexisting problems. And that is why it is not enough to get antihypertensive drugs. It's necessary to know, are there other cardiovascular problems, so that the doctor might choose a particular medicine that will not only bring down the blood pressure, but also help to address these other problems that may coexist with hypertension. So the heart is the engine room of the body, and it pumps blood through major vessels we call the arteries, and blood returns to the heart through the veins. So the heart is at the center. When the Bible says you are fearfully and wonderfully made, it was referring to the heart. Because the heart is the most wonderful organ in the body, and it is also the most fearful organ of the body. Because when the heart stops working, everything else stops working. It is the most wonderful because the architecture in the heart valves, the interior of the heart muscles, the covering of the heart, awesome. It was designed and manufactured by the master cardiologist, master creator. So the heart pumps blood to the brain through some blood vessels called the carotid. It pumps blood to different parts of the body through the aorta and the arteries that supply different organs of the body. And it keeps doing that every time. Let's do an assignment together. Do me a favor. Could you just make a fist? Make a fist, please. Now look at your fist very well. How many of you have observed that your fist increased in size after you got employed in the University of Port Harcourt? Any change in the size of your fist? Okay. How many of you have added weight after you got employed in Uniport? Don't look back, just look forward. Put your hands down. Thank you. So you can see that even though you added weight, you got more money, you got promotion, but your heart did not increase in size. So that means that you're giving the small heart the extra luggage of added weight. So the heart remains the same size. So if you can but it keeps very small amount of blood for itself through the arteries we call coronary arteries. And what is more selfless about the heart does not take blood for its own use until it has pumped to other parts. So the blood that goes to the heart comes during what we call diastole, when it has pushed out the blood, and then the one that comes back like a backflow is the one that enters to the coronaries. So the heart is the most selfless structure, most selfless organ, most selfless being in the whole of the universe. Such that even when the other organs are complaining, the heart has to work very fast to satisfy them. The only thing that it can liken to a heart is a mother in Sudan. You see them so malnourished, but they're still breastfeeding a baby from that small breast that they have, and the baby is looking very robust. How many of you have seen some of those pictures? So you can see that the women are trying to copy the heart by being selfless in their love for their babies. But the heart goes beyond that. It keeps doing that work 60 to 100 times every minute. 60 to 100 times without your knowing. The moment you begin to feel that your heart is beating, when you're conscious of your heartbeat, something is wrong. So the heart works silently without your knowing that it is beating. As you are sitting down here and now looking at me, your heart is going down. But when you begin to get conscious of your heartbeat, it means that one, it is either getting too slow or it is getting too fast. But God has designed the heart that when it gets very fast, either you're tensed up, you're anxious, or you're worried, it automatically regulates itself when the anxiety is gone. So if you're stressed and your heart rate, like you had the health talk, thank you again for the health talk or the health walk and the awareness campaign. I saw them. Very beautiful. So when you're doing that work, as you stop and you're sweating, your heart might go above 100. That is normal. But when you stop doing the exercise and your heart is still going above 100, then something is wrong with the heart. And that is when we say there's a disorder. So the heart gets blood through the coronaries. And then there's some structures in the heart we call the heart valves. The heart also has the electrical system, the conduction system. So when we describe the heart as the most efficient engine, it's because one, it has an electrical system, electric circuit, and two, it has a mechanical system that pumps the blood. So the electric current goes around the heart, and then the heart contracts to send the blood around the body, and that keeps going on. So if there's any disconnect between the electrical system and the mechanical system, something has gone terribly wrong. So the heart functions to take blood around the body, carries oxygenated blood that comes from the lungs to all parts of the body, delivers the oxygen, and then it picks up the low oxygen containing blood that contains carbon dioxide, transports it back through the veins to the heart, and then thanks to the lung where the carbon dioxide is released through our nostrils when we breathe out, and then more oxygen. So the heart keeps going through this cycle, dual circulation, systemic circulation, and then pulmonary circulation. So it keeps doing this work all the time. And of course, it carries nutrients along with it in the blood, nutrients from the digestive system. So when you take your small chops and the things being sent around, all the things go into the system through your intestines into the bloodstream, and the bloodstream takes to the heart, and the heart will now distribute it around. Equitable distribution, no bias. It gives to the brain what the brain should get. It gives to the kidney But there are some things that are more common in men than in women. For instance, why do we have more widows than widowers? Because the men bear a lot of the brunt of the family. They go through a lot. The hormones in the men put them under so much stress. And these hormones are very, very challenging. No man has lobbied me, or the men here, I have not talked to any of you. But please, if you want your man to live longer this Christmas, cut down your Christmas list. Because if you give them a very long list of things to buy for Christmas, you might end up reducing their lifespan. Men, am I talking? The race is another cardiovascular problem. There are some diseases of the heart that are more common in blacks than in whites, especially the infective conditions, endocarditis and some problems with the heart muscles. And there are those that are more common in whites than in blacks. However, that is changing because of westernization. We are copying so many things that we are not part of our culture. We have borrowed them so badly that the things that we are protective in our lifestyle, in our diet, are disappearing. These days, we're even more westernized than the Western world. You go to some villages, you see that the cardiovascular dichotomy that used to exist between the rural area and urban area have disappeared. In some rural areas, every weekend there's burial. The amount of alcohol they take to the villages, the amount of cigarette they take to the villages. So you find those village men drinking more alcohol than those in the city. Because some people think that the more alcohol you load the villages with, the more they recognize that the burial was befitting burial, the amount of alcohol shared around. So that has made the dichotomy not to be too clear. But we know as well that the race, the blacks, are more prone to having some cardiac conditions than the whites. So these are non-modifiable. You cannot do anything about them. But there are cardiovascular disorders that are modifiable, risk factors that are modifiable. You can do something about them. And the modifiable risk factors contribute to about 70 to 80% of the cardiovascular problems. I mentioned the age, the gender, the race, the family history. Yes, these are there, risk factors, but they're only 20% of the entire risk. The remaining 80 are due to things you and I can do something about. And chief of them is systemic hypertension. When somebody is hypertensive, you can do something about it by knowing the numbers, knowing the blood pressure level, finding out what medications are necessary, taking the drugs appropriately, and living according to the advice of your doctor. The second thing is diabetes mellitus. Diabetes is a modifiable risk factor because some people have lived with diabetes for over 50 years. In fact, we say people living with diabetes. People can live with diabetes and not die of diabetes. So it's possible to live with diabetes to ripe old age and not die of hypertension, of diabetes. Excessive alcohol consumption, cigarette smoking, excessive salt intake, obesity, sedentary lifestyle, and abnormal cholesterol. So let's talk about systemic hypertension, which we consider as silent killer because many people don't even know they are hypertensive until a problem happens. A study was carried out in which more than 10% of people that came with stroke never knew they had hypertension. They didn't know. And the problem is the poor diagnosis of hypertension. Because some people don't have hypertension and they are taking antihypertensive drugs. So having a raised blood pressure is not the same thing as being hypertensive. Please, if there's only one thing you're taking from this discussion, know that somebody's blood pressure is raised doesn't necessarily mean a person has hypertension. Hypertension is a raised blood pressure that is such a level for which drug is required to bring it down. Or raised blood pressure that has caused changes in some vital organs of the body that can only be attributed to that raised blood pressure. So if there are kidney problems, there are eye problems, there are cardiac problems in somebody whose blood pressure is raised, and you can only show that these problems are attributable to the raised blood pressure, then the person is said to have hypertension. If, for instance, there is explosion in this room now, we'll run out of this place. Many of us, our blood pressure will destroy the BP machine because it will shoot beyond the range. But after 30 minutes of knowing that it's under control, our blood pressures will come back to normal, and then we'll go about our duty. So we may not need antihypertensive drugs. So those people have raised blood pressure, but they are not hypertensive. So it's important we know the difference. People have died of complications of hypertension, and people said died after a brief illness. Those illnesses are not brief. Oh. They've been going on forever, just that the person never bothered to find out what is going on in the body. So died after a brief illness is not correct. Something had been going on that was not identified. So blood pressure range that we consider number 120 to 130 over 80, over 90, depending on the range and the target organ changes. And we have different stages of hypertension. So the burden of hypertension in developing countries is a big problem. Because one, in blacks and in developing countries, hypertension starts earlier than in the white population. So you find young people now having raised blood pressure that requires medication. Again, I explained the difference between hypertension and raised blood pressure, that in raised blood pressure, you don't need to take medicine to bring it down. But when the blood pressure is so raised and sustained at a level for which you need to use drugs to bring it down, then that person qualifies to be said to be hypertensive. Or we see that there are changes already happening in that individual's organs that can only be attributed to that raised blood pressure, then we say that the person
working for a husband may not work for the wife. You love your husband, you love your wife, yes. But the cardiovascular health of the man and that of the woman is not the same. So don't say, darling, can I borrow your BP medicine and take today? My own is finished. No. Love doesn't apply to that one. Because the changes in the individual is unique. There are people that cannot tolerate certain medications, but they can do well on other medications. And the BP drugs are not that sentence. Sir, when you take your BP drug and you go to the other room and you cannot perform, tell your doctor, don't throw the drug away. There are other drugs the doctor can give to you that will not affect the other functions. Or if you have to take BP drugs and you have some other symptoms, coughing, urinating too much, let the doctor know, because there are some BP drugs we give that could make somebody urinate more. And we can tell you when to take that BP drug. Don't take it in the night. Some have accused us. I want it hypertension. The doctor has given me diabetes because that they're urinating more. That is unfair. They are accusing your doctor of invoking the disease. That ignorance has made the person to carry home. So let the doctors know the things you notice when you take your medication, and that way the person will live healthy. Diabetes is a big problem. It's affecting so many people. There are genetic factors and environmental factors for diabetes. And fasting blood sugar is a good way of knowing when the person has not eaten for about 8 to 10 hours throughout the night. Early in the morning, blood pressure is checked, blood sugar is checked. If it is more than 7 millimoles per liter, it means that the blood sugar is high enough. However, we also know that there are some people who are diabetic, who will only take their medicine when they are coming to see their doctor. They don't want the doctor to get angry. They take the medicine and come to the clinic. Your blood sugar is 4.2, you're doing very well. Now, doctor, you know you're my friend, I'll have to follow you. And the person comes back a few months later with diabetic foot ulcer, with recurrent infection, with problem in the eye that is due to diabetes, because they are not adhering to the diabetic drug. Some people are even afraid of taking insulin. Somebody I know died after taking insulin injection. Somebody you know died of road traffic accident. What did they tell I wanted to drive to work today? People die in plane crash, they will still fly. It depends on the dosage and the risk level, and that is why knowledge is important. So let's not assume that the things that went wrong in places will always go wrong with us because of unwillingness to adhere to instruction. So diabetes
problem. So we use the HbA1c, glycated hemoglobin, to check how the blood sugar has been. So we can use that to know whether the person has been taking the drugs as instructed. And that is very helpful in making the diagnosis of hypertension, of diabetes. So many people that have diabetes also have other comorbidities. So diabetes and other cardiovascular things may coexist, just like we talked about hypertension. And one of the things that could coexist in diabetes is abnormal cholesterol, raised blood pressure, and of course, some inflammatory changes in the blood vessels, obesity, diet, and the heart. You know, I enjoy when people hear me say, Prof, all the money Uniport is paying is not showing in your body. I see if they know how much you are paying. I'm an ASU. So, but they tell me you should look professorial, grow some pot belly. And I tell them, you're wishing me that. So pot belly and obesity is not evidence of arriving. If you have your cousin or your uncle or your auntie that is beginning to get pot belly and is getting very obese and say, I've arrived, now lie. The man is actually departing. Obesity and pot belly is evidence of departure, not arrival. So when they begin to add too much weight because they've gotten a job in one big company and they're paying them big money, they go to staff club and they drink all kinds of things, please advise the person and let the person know that he doesn't have to take the boarding pass for the departure. Obesity is a problem, and it affects the heart. I showed you a while ago that your heart is about the size of your fist, and the more obese you are getting, the more work you are giving to that heart. I have a picture of a gentleman that was digging his grave with his teeth. Some people actually dig their graves with their teeth, with the kind of things they eat, not making good choices. There's a difference between overweight and obesity. Now, some people are borderline overweight, but when the weight has gone above a BMI, body mass index, you say there's obesity. And worst of all is truncal obesity. Truncal obesity, those fats are deposited and they affect the organs of the body. Of course, they also affect the blood vessels, the small arteries that supply blood to the heart. We talked about the heart being a selfless organ. It sends blood around all the body but he keeps very small for himself. Imagine that now you're allowing some cholesterol to clog those blood vessels that should supply blood to the heart. The heart can't cope with that, and that's a problem. Urbanization is a risk. Cigarette smoking is a big risk. Just last week, 2 weeks ago, I went for my friend's inaugural lecture, and I liked the way he put it. He said that among the chemicals in cigarette is formaldehyde. Formaldehyde is one of the chemicals inside a stick of cigarette. And formaldehyde is the material we use to embalm bodies in the mortuary. So for every stick of cigarette somebody has taken, he has embalmed some cells in his body. And the more sticks he's taking, the more he's embalming his body every day, every week, until he has embalmed. Do you understand the seriousness? So you can see the danger in smoking cigarette. Not just active smoking. There are those we describe as active smokers. They put the cigarette in their mouth. Yes, active. But when you sit beside somebody or in the same place, somebody who is smoking, you are also smoking. What has only changed is the nomenclature. We say you have become a passive smoker. And passive smoking is even more dangerous because you're inhaling all of the things they're pushing out. In fact, some hotels, they say this is a non-smoking area. And you see people who go to the smoking areas because they want whatever they get from cigarette smoking. Even at the airports. In fact, there are some places you go, you see them in the chamber of smoke. They are going there and say, these people are killing themselves over time. So there's no single benefit from cigarette smoking. All the chemicals in cigarette are harmful to the body. And it is more terrible when the person is a smoker, is into so much alcohol, and sometimes they go to the relaxation sport. Relaxation sports. What do they do there? Pepper soup, issue with lots of salts and spices. And then they take so much alcohol with it, and they smoke cigarette, and they sit in one place and crack all the jokes, and they come out of the place looking very obese. And there's rainfall. When the rain begins to fall, and they try to run to their car, the person slumps. He said the evil people have done their worst. Now lie, oh. No evil person did anything. It's the person that built up the things that added to that crisis. So we must avoid those problems. So the obesity problem is increasing because of urbanization, and we must exercise to drop weight. Now there are some other things that we see to the children. They're only building up cardiovascular problems that will come up much later, and that has to be avoided. So these cardiovascular problems affect the blood vessels. They build up, narrow the arteries and the veins, and cause kidney damage, cause brain damage. Kidney damage as kidney failure, which could manifest as puffiness of the face, frothiness of the urine. The urine is foamy. If somebody urine, as if they put detergent in water and they shook the thing, that is how the urine shows when they pass urine. Why? Because their urine contains so much protein. The protein is leaking from the kidneys, and that is a damage due to hypertension and diabetes. In the brain, there could be severe headache, stroke, and all the problems in the brain can happen due to this cardiovascular problem. There could be blurring of vision. We had an outreach some time ago, and we found a family where about 4 of them were blind, and their blood pressures were terribly high, but they didn't know. Very high optometrist and ophthalmologist. Optometrists are the ones that cut glasses and you can wear after the ophthalmologists have examined your eyes to find out the kind of material you should wear. Not when we cannot see, go and meet one side by the roadside and they give you glasses to wear. No, that could be hiding the diagnosis. There could be something fundamentally wrong in the eyes. So the ophthalmologists are trained to recognize the disorders in the eyes. Some may not require glasses. It's not all the eye problems that require glasses. And that's why we must look after ourselves very well. And the easiest way to know whether there's a cardiovascular problem is basic ECG. Again, register, please don't be angry with me. How many of you have done your ECG in the last 6 months? Show your hand. ECGs. Okay. In the last 1 year, how many have done ECG in the last 1 year? In the last 2 years? Show your hand. Let's know, because we might decide to do free ECGs for you. If you don't show us, we won't know. How many have done? So you see, ECG is a very simple investigation that costs about 2,000 naira. At most 5,000 naira in some places. You can know the things happening to the heart, because the heart's electrical problem is the first to show that there's a challenge, because the heart muscles, as the current is going through, will show some changes. So the ECG is very fundamental in knowing whether the heart is working well or not. And when the ECG shows the electrical activity, it could show the heart rate. It could show if there's a damage in any part of the heart. It could show if there's a heart block. And with the ECG, we can tell when somebody has complete heart block. In 2012, I remember Mr. Humphrey had to interview me after we did pacemaker implantation in UPTH, 2012. We found a gentleman, a football coach. He will always fall down when he's taking his boys for training. And they were treating him for epilepsy, seizure disorder. And a good neighbor of his put his hand on the radial artery and felt the heart rate was 24 beats per minute, pulse rate, and brought him over to us. We put a pacemaker for him, and he lived with that for over 10 years. So the heart block can only be found if an ECG is done. And many people have heart conduction problems, and they're moving around. And when you push the person or you quarrel with the person, they say you killed somebody, whereas the person was a moving corpse, because the electrical activity in the heart is already bad. So ECG is very important. The other thing we can do is to look at the heart muscles and the way the heart is pumping, the echo. And those are just as is important. You know if there's a cardiovascular problem, because you can see the size of the heart, you can see the lungs, you can see the surrounding structures. Because if somebody has a long-standing heart problem, the size of the heart will be bigger than normal, called cardiomegaly. So those are things that can help the doctor when the doctor asks you to do them. Don't think the doctor is trying to make you waste your money. No. He's trying to have enough information to guide you correctly. And with this information, they will know what medicine will be most appropriate. Like I said earlier, many times we don't give medicine to bring the blood pressure down alone. We give drugs based on the cardiovascular risk pattern and to address asthma. So you might find one particular drug will not only bring down the blood pressure, could also help the nerves, could also help the heart contraction. So these medications are meant to be tailored to the needs of the patient. Heart attack is when the heart is blocked due to clots or buildup of cholesterol in the arteries that supply blood to the heart. And it's a very big problem. It can kill easily. Heart block, those are complications for which will require pacemaker implantation. Heart failure is when the heart is struggling to work. It cannot cope with its usual activity except there's an extra effort, feeling pressure. So if somebody could ordinarily climb up these stairs to that point without breathing heavy, when the person begins to breathe heavy after climbing, that means that the heart is struggling to cope with the work. So heart failure is a problem, and it can creep in very slowly. But we must always differentiate heart failure from problems in the lungs. Some people may be asthmatic, may have lung problems, but when you see or not, they can tell whether the heart is going down or not. So exercise is important for the heart, forms of exercise. And of course, you don't suddenly start doing some exercise you're not accustomed to. I'm happy you had the ambulance. I saw the ambulance parked in front of the SNAP building. Was there any casualty? Very clap for yourselves now. It's not easy to walk the many kilometers and nobody fell down, nobody fainted. It shows the registry department you're very good. You're health conscious. So if you're not accustomed to a particular form of exercise, please don't go into it. Some people have bought treadmill. I spent 2.5 million to buy the treadmill. I must enjoy it and recover all the money I spent. And the person keeps and then slumps there and dies on the treadmill. Real life. Some have gone to buy some massage chairs. The chair will shake them, They want blood circulation. And will shake off a clot that is hiding somewhere. And it will go to the lung and block the lungs and the person will die. So don't get into unaccustomed exercise. Don't go to the gym and want to recover all the money you pay to the gym in one day. It's dangerous. So you have to start by walking first. Then you can increase your pace. Then you can increase the distance. That way, your heart gradually adapts to that exercise. The heart adapts to exercise based on how often, your regularity. So awareness is important. Awareness is not enough. You get to know, and you have to understand it, and you have to apply the knowledge you have acquired. And that is when we say you're wise. A wise person is somebody who has acquired knowledge with good understanding of that knowledge and has applied the knowledge to his everyday life. So you need wisdom. Lifestyle modification. Not all the cardiovascular problems require medicine. Some could just stop eating this kind of food, exercise more regularly, sleep, rest. Rest is important, sir. Rest is medicinal. I know that the university does not joke with the leave. Some people are giving their leave, man. They go and start building one project in their village. They want to go and take one chieftaincy title. They want to go and start fighting one person for their grandfather during leave when you should be resting. And that will not be a portion in Jesus' name. So leave is meant for you to rest, to recuperate, to recover, to come and continue your work. Rest when you're meant to rest so that you live long for your family. Dietary adjustment, reduce the salt and cholesterol, I've said earlier that cardiovascular health and cardiovascular treatment is individualized. Just like you go to heaven alone, you're not taking anybody along with you to heaven. The same way with cardiovascular health. Your cardiovascular health is individualized. The medicine you require may not be what the other person requires. Don't say somebody I know suffered this kind of a thing. Go and use what he uses. It's not true. They may look alike, but they are not the same thing. Thank you very much for your attention.
Can we clap as if we understood what he said? Thank you so much, Prof. I don't know how I missed it. We may resume our seat, please. I don't know how I missed it. I just realized that I didn't introduce the university librarian, Professor Helen Emesialo, who joined us. I think a lecture of this nature usually gives birth to questions. So we will have some questions from members of the registry department who have listened attentively. So if you have a question, you signify by raising up your hand and the microphone will be brought to you. Do we have another? Okay. All right, so I've seen one hand and then the microphone is moving to her. Introduce yourself and ask your questions, please.
Okay. Good afternoon, Registrar Ma and other persons on the high table. So my question is on, when we're going to take our BP, because I can't remember at any time when I went to check my BP and the medical personnel checks and tells me that my BP is 125, for instance, or, that fraction on it. And you said that it's a thing of, it can jeopardize our, our health in the long run. And so I don't know whether others have experienced that also, but so I wanted to, because you said we should check to ensure that the correct reading meaning that they should not approximate to a whole number, as it were. So I wanted to suggest or say, is it the place of the patient to say, no, nurse, please, is 124, for instance. Don't make it 120 as it were. So being the people who know these things, is there anything that you can do on your part to ensure that the people who check our BPs, for instance, give the correct reading and not to approximate anything, not to jeopardize our health in the long run? Thank you.
Thank you so much. Prof, would you like to answer immediately or you take other questions? Okay.
Please permit me to stand in existing protocol. Sir, please, my own may be question and at the same time I want to achieve in. I know that when I was younger than this, I was very fat. I was very fat to the extent I was not having neck. I was very fat to the extent I can't walk from there fast to there. I will squat down and breathe and I listen to my heart. But on my own, I sat down. Nobody advised me because I lost my mother when I was very tender. On my own, I sat down. I said, what can I do? And people would be saying, you look like obesity. I didn't understand that. But when I grew up, I now know that obesity is somebody who you have passed the normal size you're supposed to be. So on my own, I take that decision. I live to eat anything carbohydrate, and I go on fruit salad. And that fruit salad, I prepare 5 plates every day. I will take 2 in the morning, then I will go to work. In the afternoon, I will take 1 plate as my lunch. At night, I will take 2 as my dinner. Then I did it for about 6 months. No plantain, no cocoyam, no sipping of Gary. But when I feel like eating eba, I'll prepare a good soup. Then I'll sit down, I'll lick the soup, and I'll satisfied. And I find out that before 6 months, people are started asking me, Mama Jo, are you sick? And I say, oh, okay, that means I'm coming down. And when I went to check my weight, I will weigh 120. And from that 120, the next day I went to check, I found out I was weighing 80 something. And somebody was, what did you do? And before that time, I wasn't myself. I can see that I perceived my heart pounding as if it will pound to the extent I will be vibrating. But when I finished doing this, I find that I have that peace. Now, glory be to God, I am not a BP patient. I am not a diabetic. Yes. If I go to health center to check my BP, after checking, they'll say, Mama, your BP is a baby BP. And the initial that BP, baby BP is somebody who does not have BP at all. And I asked the doctor, I said, why will I have baby BP? And they said, my BP is fine. And I want to say, please, on your own, just sit down. Know what you can do for your.
Thank you. Your point is made. It seems this is the only rule that listened attentively and understood what the lecturer was saying. Please, if you have questions.
I usually hear high BP and low BP. And they will say low BP is more dangerous than the high BP. I don't know which is correct. What they say, low BP is very, very dangerous. But the high BP can be managed. I don't know which one is correct, which is right.
You know that, okay. Let's be democratic, giving microphone to people on this road.
Good afternoon. My name is Uniport. He said because of what we eat through the years, we eat things that probably would have blocked our veins, blocked what gets blood to our heart and all. I want to ask, is there anything we can do at this point to get those things off our veins? Another thing I have is, you may sleep and then you have like a pain in your joint or something, and then it doesn't get swollen, but you still feel the pains. What would have happened in that case, and how can you reverse? Thank you.
So far, so only one rule, missing attentively and understood correctly. Any other question, please? The microphone gets to the lecturer.
Thank you very much. I'm happy you asked those very important questions. And that shows that you listen to the lecture attentively. I'll start with the last question. I want to say, now you should come.
They will flush the blood vessels. That's a dangerous thing to do. They are not flushing any blood vessel. But what we advise is to know what are the problems. For instance, if somebody has a very high cholesterol level, we'll give some drugs that will help the body to handle the cholesterol. And when we get those drugs in the system, they not only remove the cholesterol in circulation, they even help to reduce the ones that are blocking the arteries. Because when the cholesterol is too high, it gets deposited in the walls of the arteries. And when it is deposited, it narrows the available space for blood to flow. So that narrow space does not allow enough blood to go to the target organs, to the places where the blood should go to. And worst of all, when the thing gets too narrow, there could be a crack on the wall of the plaque, the cholesterol buildup. and blood cells will go to clump the place and completely no more blood going beyond that point. And that is the reason for heart attack and even brain attack, some stroke. So taking the drugs to control the sugar level, to control the cholesterol, will reduce the risk, and not taking anything that will promise to flush the blood, no. In natural fact, some people, not doctors, some fraudulent people will give you some furosemide, a drug that makes people to urinate, and then they'll give rifampicin, another drug that will color the urine, and they will take the two, and they start urinating reddish thing. They say they are flushing their blood. It's a lie. That is fraud. And doctors don't do that. Some of these roadside people say they want to flush blood. They give rifampicin and furosemide, and the person is urinating because one of the drugs will color the urine, and the other drug will make the person urinate more. So please, let nobody fall into their trap. There's no such thing as flushing the blood. The second question you asked about the, sorry, just a second. Right, the joint pains. Pains in the joints can arise from so many things. If somebody is obese, again, if you liken it to the hinges of a door that is meant to be wood, and somebody has gone to put an big iron door on that small hinge, that will be too much for the hinges of that door. So the hinges will be cracking. So if the joint is designed by God to carry, say, 80 kilograms, and the person goes to weigh 120 kilograms, over time, the joints will begin to wear off. Arthritis will set in. And that is one big problem that people have from obesity. So obesity is a cause of joint problem. Of course, the others could be due to overuse. Some athletes, some sports people over the years, if they're not well looked after, because of the friction between those joints, may have arthritis. So that's one thing that can cause joint pain. Sitting in an awkward position, some sitting with their legs crossed. When you sit in an awkward manner, you try to get up. Those joints may also complain that they were not in their best forms. So to the question about low blood pressure, right. Some people have had to go and start drinking salt because they want their blood pressures to come up. Man, that is a dangerous thing to do. In actual fact, there's nobody that has died of low blood pressure. That is physiologic. What could keep people is if somebody takes anything that lowers the blood pressure. For instance, if somebody is having diarrhea and vomiting, the blood level will go up because there's so much loss of fluid. They'll have low blood pressure. If somebody has had a baby and has bled so much during delivery, the person could have low blood pressure because the blood loss is too much. But under normal conditions, some people's blood pressures are created by God to be at the low level, 100/60. My dad is in his 90s. His blood pressure started going up to 140/80 just a few years ago. He always have 100/60, 100/70, and the same way. So some people are programmed to operate at a low level. That's not a sickness. But when the pressure is so low that the person is very weak, cannot move around, cannot carry out the activities of the day, then that blood pressure is such that we should find out the cause of that drop in blood pressure, treat the cause of that drop in blood pressure, and the blood pressure will normalize. So not to go and drink salt and other such things, take drip to raise the blood pressure up. No, that is a dangerous thing to do. Thank you for your comments. You just shared your experience about lifestyle measures, how you are able to control obesity. Not many people can afford so many vegetables and salads, but you can start small, cut down. We call it portion control. I'm not a strong advocate of abstinence from carbohydrate. No, it's not healthy because you need the carbohydrate, you need the energy, but the quantity of carbohydrate you take is what makes the difference. If somebody goes to take one heap of eba or pounded yam, and use, worst of all, that is your dinner, that is dangerous to the health because your body is piling up calories that is not going to use anywhere. But if you take that as your breakfast, take carbohydrates in your breakfast or lunch, as you're going about your day work, you're burning up the calories, and then you live healthier. So, but for diabetic patients, yes, because we already have issues with sugar, so you have to avoid all those things that could push the carbohydrate level high. Obesity is a problem. Obesity is measured in so many ways. Now, there are some people who come from families that are on the big side. For one of my friends in medical school, he was on the big side, but he can't run faster than him. When we saw his parents, we understood that this big size, and the bone size is not like the type of people who are obese of medical image. Those who are obese, obesity, they don't have the support physiologic capacity. So just sudden increase in weight, that becomes a problem to the organs of the body. Approximation of blood pressure. Yeah, you don't have to be rude to the nurse. But if you ask nurse, what's my blood pressure? 140 over 90. You come back the next time, what's my blood pressure? 140 over 80. You know that they are approximated to the nearest zero all the time. So when you request a doctor, please, could you check my blood pressure? And you can even ask the doctor politely, but I understand this, your machine is calibrated in twos. How come it's always the nearest zero? The doctor will know that you are in this lecture, and the next time you go to the hospital, they will pay more attention to you. Is there any question I left unanswered? All right, thank you.
Another round of applause for him, please. I know that we have more members than this, but the truth is that only a few of us are here, and we are now better informed about our heart. The lecturer told us that the heart is very selfless, very humble, and very equitable, impartial in terms of distribution of blood. He also let us know that the most important thing is not just acquiring the knowledge, it's the application of the knowledge. As we have learned this today, I believe that we will apply all that we have learned, because the application of knowledge is power. Thank you very much. May I invite the Chairman, Planning Committee of Registry Day 2025. That is the 14th Registry Day. Dr. Promise Alone for the vote of thanks. I thought we would clap for the chairman who had brought the lecturer.
The registrar, our lecturer for today, Professor Chibike Ezewafo, the Director, Academic Affairs, Acting Director, Personnel Affairs, Acting Director, Council Affairs, my employer, senior colleagues, ladies and gentlemen, I am very, very happy for how far we have come so far. Today is the first day of our registry day. We had some hitches along the way, but I'm happy that it's ending on a happy note. We'd like to thank you very much, Professor Wafo, for coming back again. We are very sorry for what happened initially, but we thank you. We are happy that you came back, and we are better informed now because you are here. We also want to thank all members of the registry family for coming in your numbers. We've had the health check, we've enjoyed the health walk, and we look forward to seeing you tomorrow for another day of what promises to be a very interesting activity. We thank you for coming, and we look forward to seeing you tomorrow. We thank you, our registrar, for the support, for the encouragement all the way. I just want to mention something that I've observed now. A few of our colleagues have hinted that they were not aware of these activities. And so I want to appeal to us, faculty officers, heads of units. You can't have this information alone. Please pass it on to members of staff in your faculty, in your offices, so that tomorrow the number will be much bigger than what we have today. Tomorrow we'll be having the cultural day, and then we'll have a football match. Tomorrow, we ask that you please dress in smart native. Smart native because we'll be having people from the arts village who will perform. And at that point, if you feel impelled, you can join them and do some performance, dance, play, enjoy yourself, and have fun. But most importantly, we also have the football match between the registry and the bursary. I'm very happy because registrar has assured us that we are going to win them. So come prepared to cheer the registry team. It's going to start by 3:30 and hopefully end by about 5:30. So come prepared for tomorrow. Once again, I want to thank you very much for today, and we look forward to seeing you. Thank you very, very much. The time is 3:30. It will be starting by 3:30. By 3, we can be at the stadium. It's going to be at the stadium just along the way. Yes. The idea is that this is a week-long activity, and we don't want to close the offices for all 3 days. We've been out of the offices today. Tomorrow we'll come to work. We'll do our work till about 3, and then we'll go to the stadium for the cultural performance and the football match. So come dress in your native attire, smart native. Come to work, walk. Sorry? All right. Dress comfortably so that you can join the people from the Arts Village and cheer your team during the football match. Thank you very much.
As we draw to a close, as we leave this place, as we depart, let's not forget that the truth you know and act on guarantees your safety. I'm handing over the microphone to Dr. Nabo for closing prayer.
Let us pray, please. Where are you going out when we want to pray? Tomorrow, the chairman said is our cultural day. Please, let's appear on our cultural attire and then be at the stadium by 3. At least the gyration can start at 3:30 when the football match will start. And then we need to cheer our boys, our men up at that stadium for the football, please. It's a registry team, and I'm surprised that the registrar will do all she can to put up this for us, and we will not come out for something they have set aside for us. It's not right. Please, let's go back home to our various units, tell our colleagues to come out, tell those who are under us to please be part of it. Let us pray. Our Father and our God, we want to thank you for 50 years of registry in University of Port Harcourt. We thank you for all we have done, for the achievement for these 50 years. We thank you for this year Registry Day. For all we have put up together, we ask that you come and take charge of them together for us in the name of Jesus. Tomorrow will be better than today. And next tomorrow will be the climax. We pray that every one of us will come out in our numbers to support the growth and development of our unit. Things we ask through Christ our Lord. Amen.
Group photograph outside, please, with the resource person. And as you are leaving, be smiling so that those who missed this opportunity will ask you, why are you smiling? And you tell them,